I'd request Honorable Union Minister Shri Bhagwant Khubaji, Mr. Milind Thatte, Mr. S. Sridhar and Mr. Anant Krishnan to stay back with us on screen while I invite Mr. G. Satyanarayanan, Managing Director, South Asia Galderma India Private Limited, Susan Josi, Managing Director, Havas Health and USEA and ME Region, Ms. Nitika Garg, Director Research, OPPI, to join us on screen for the next segment of OTC Report. A very warm welcome to all of you. Ladies and gentlemen, as we move towards releasing the OTC report on this platform, I'd like to take you through an audio visual of the OTC report. Can we have the AV, please? Thank you. I'd request all our dignitaries, Honorable Union Minister Shri Bhagwant Khubaji, to please hold the report up facing the camera for the official over-the-counter report release. With that, ladies and gentlemen, we officially release the over-the-counter report. Thank you so much, everyone. I would request Honorable Union Minister of State Shri Bhagwant Khubaji and Mr. Milind Thatte to kindly stay with us, as I request Mr. Milind Thatte to please throw some light on the value of this over-the-counter study in India. Over to you, sir.
Thank you, Kathy. Over-the-counter medicines evoke a lot of interest among all stakeholders. This is a topic which is very hot and has been under discussion for almost now, I would say, 1.5 decades. A lot of stakeholders have really worked towards this topic. In fact, OPPI was one of the leading organizations to move in this direction. And later on, OPPI joined hands with other organizations like FICCI, with also Indian Pharmaceutical Alliance, and also with consumer groups to understand how OTC, what is the value of OTC and how the OTC medicines can really make a lot of difference in the lives of Indian consumers. And so to say, there are a lot of minor ailments for which a proper OTC rules can really help the industry to not just grow, but also bring down the burden from the healthcare expenditure standpoint, which is out-of-pocket expenses today. So, basis this entire background, OTC, so OPPI joined hands with some of the member companies and with Havas Healthcare to get an insight about what is the real value of OTC. So this was the report. Basis that the report was published, and I think it was during the COVID times that we realized the importance of OTC and the need for framing the right rules for OTC so that responsible self-medication can be advocated in this country. So with that, I hand over back to you, Kathy, to invite our other guests.
Thank you so much, Mr. Milind Thatte. Here, I would also like to express my heartfelt gratitude to Honorable Union Minister of State, Shri Bhagwant Khubaji, for sharing his thoughts and for his gracious presence. We'd love it if you could stay with us a little longer, but thank you so much for being here.
Thank you so much. Thank you so much. Thank you.
Very special day. Thank you. And thank you, Mr.
Thank you, sir.
Moving forward, I would like to welcome Susan Josi, Managing Director, Havas Health and USEA and ME Region, and Ms. Nitika Garg, Director Research, OPPI India, to share the insights of the over-the-counter report. A very warm welcome. Over to you, ladies.
Thank you, Kathy. Thank you so much once again to OPPI, because this report has been really waiting to be launched. And I must say that the kind of support and the championship that OPPI OTC Task Force took up to make this happen is something that I would be ever grateful for. It was a dream come true, because ours was one of the only countries which really didn't have a kind of an identification of the economic value that OTC would really mean for our country. So I have Nitika with me. What I'll do is, for the next 5 to 6 minutes, I will give you an overarching view of what the report is all about. And then I will also hand over the mic to Nitika to give her viewpoints on how she sees the implementation of this report affecting, the value of this report affecting the implementation of our policy. Is that okay, Nitika? So I'll move ahead. Yeah, okay. So just going to the next slide. What is interesting is, and this is actually a very, very interesting framework of self-care matrix, because we always see self-care in 4 layers. And this was something that was published as a paper 2 years back, where they clearly saw that, while on one side, you have the self-care activities, and like Milind rightly said, the COVID has actually made people far more aware about health. They are taking health a lot more into their hands, but they're uncertain. They're really concerned. They really don't know whether they're doing the right thing. So at the micro level, they're doing things on their own. So whether it's about eating, whether it's about their physical activities, it's there. Then some changes that they do as far as their behaviors are concerned. People are trying to live far more healthy. And within that, there are a lot of comorbid diseases where a self-care context sets in. So it's not just about doing self-care when you want to prevent, but you also are doing when you are in a comorbid situation. But last but not the least is, how is the self-care environment in our country? In any country, this matters a lot. And if you ask me, this is really the crux of what creates the ecosystem, the platform, the environment for consumers to really practice self-care. And this is actually where we have now added value by doing this study. So just to go to the next slide, what really was the importance behind this study? We have always seen that there are countries around the world who have realized the economic value of OTC. In fact, just to quote one study, which I felt was really interesting, that just moving 5% of prescription medicines to OTC resulted in a savings of almost 16 billion euros. Now, these are the kind of figures, these are the kind of numbers that we are seeing, which was done across, and people have done a number of studies in a country or even in the continent. And that brings me to the next slide to ask this very pertinent question: why should India be left behind? So if I just go to the next slide, that's the question that I'm raising, that why should we be left behind? And that's where I would like to, spend the next 4 to 5 minutes. I know it's a rush. Can see the report, but just to kind of give you a top line information on how this study was constructed, we have launched the first value of OTC study in India. And to go to the next slide, it is first of its kind. We really wanted to understand that when we say that our consumers are today in the journey of managing their ailments, and we're talking of minor ailments, we're really not talking of the major ones. What is the kind of out-of-pocket money that they're spending? Where is the journey? Where is the treatment journey? How often are they going to the doctor? What kind of expenses do they have? So just to give you an overview of how we went about the study, to the next slide, it shows that, we actually looked at those 27 common ailments which tend to witness self-medication. So we took it into all the ailments, and this is something which we have always mapped, that, there are specific disease conditions or general ailments where consumers are self-medicating. So we mapped these 27 common ailments, and we also looked at the universe from the lens of NCCS A and B, which went across 25 towns, including the metros, Tier 1 and Tier 2. We actually went to these households. Of course, we did it through online because it was something that we had to do it during the COVID. And it was something that which moved into a space where we could move on to almost 9,000. We actually could interview around 9,797, consumers. And they were mostly housewives. In fact, from the household, it was the housewife. And if it was, about 12 years of age, they spoke on behalf of the kids, and finally got responses to the extent of around 6,700, which was plotted and extrapolated to 123 million consumers in 95 towns. And that gave us the scale and vastness. So if you see, we see them in three lenses. There are people who go to doctors when they see an ailment. There are people who self-medicate. There are people who go to pharmacists. And between all of them, they're always doing something which is like self-medication, plus doctors, plus pharmacists. So we could map this very, very clearly. Our report has captured this in greater details, but just wanted to tell you that we went into quite depth and rigor to understand the treatment journey. So what was the impact? We'll go to the next slide. So clearly self-medication to the extent of 39%, where we also looked at the pharmacist recommendation becoming part of it. But what was important and what was really key to our outcome was the significant dependence on doctors even today. And what we also felt was something that we could really put a finger on was that only 13% chose to seek pharmacist advice. We actually tend to believe that, consumers do go to pharmacists and ask pharmacists, but with all the Google that is happening, with all the plethora of information going around in the WhatsApp university, one really doesn't know how much are they relying on the pharmacist, and is the pharmacist really empowered to give information to these patients or consumers in the right manner. But the implication of this 58% dependence on HCPs, if you go to the next slide, is where the eye-opener is, because the translation of that, when you see from the way we extrapolated it, it comes to almost 35,820 crores of expenses or spends which are happening from the consumer's end, which is almost equivalent to 46 million or 47 million USD. That's the kind of money that people are spending on these minor ailments, which is a sum total of what they're spending with doctors, what they're spending with on their by self-medication, but also through the pharmacist. What is important, which you'll see in the next slide, that out of this 35,820 crores, 86%, if you can go to the next slide, it actually is translated. The contribution comes because of the money they spend through the HCPs, okay? Which only tells you, and how this kind of sums up is that there is a cost which they are paying for the doctor's consultation, for the medicines, for the diagnosis, and also for the transportation and communication. And to some extent, we also actually calculated the loss of, a day loss or a 3 days loss or a 2-day loss that they had because of the effort that they had gone to meet the doctor. So when you put all of this together, it's almost something like around 40 million USD or 30,000 crores or crores, which is being spent just because of the reliance on doctors. And these are minor ailments, mind you. It's not really the major ones. I'm stressing this again only to tell you that it only means that the more we keep empowering our consumers, the more we do something with our pharmacists, this dependence on doctors, while we are seeing an economic value, we also know that we have a huge patient load on our doctors. The ratios of our doctors to patients is so absurdly low. And that is where we need to unlock. That is what we need to kind of release. Because if we can empower our patients, this is where our savings lies. This is where we can build a better, resilient India and who is more self-responsible. Because if you go to the next slide, a lot of the money that is spent by consumers is in ailments which they can manage and of course, pain-related ailments take a lot of spends from the doctors. Maybe they don't know how to go about it, or even when they know about it, it's not really done in the right way. There is no great information that is accessible to them. So something is amiss here. If you deep dive into each of this, we have done that analysis, you'll find that there are reasons why patients just rush to a doctor, or possibly they don't have the confidence, or they may be not really doing it the right way. And that's what the gap lies from a policy level, from an industry level, that we can start, working on. Just to go to the next slide, just one more slide to tell you that when we did a back-end calculation on some of the ailments, which today they're unnecessarily spending with doctors, you could save up to 43% from HCP spends for ailments with higher self-medication. Similarly with pharmacists, empower the pharmacist, and you could get a savings of almost 37%. And this is what really are stark opportunities for us to move and see how is it possible for us to empower and engage our patients, consumers, in a much more meaningful way. So this is all there in the report. The report is available. We have a lot more data points that we have worked on. But with this, I would like to hand it over to Nitika to sum up what is really the opportunity for us to unlock the potential of OTC in our country. Over to you, Nitika.
Thank you, Susan. Very good evening to all of you. As rightly mentioned by you, Susan, OTC medicines are truly a critical component in advancing these consumer health, and as they allow people to really self-treat or manage health conditions conveniently and responsibly. In our country, where cost of primary, secondary, and tertiary care is really expensive, the robust OTC policy can help bring down the cost of primary treatment by providing patients safe, effective, and easy access of such OTC products. And we truly believe that formulating an inclusion of OTC regulation will strengthen Government of India's initiative to revamp the DNC and DMRA Act. I, along with Susan and with all the stakeholders here in the industry, we are driving this whole initiative that we have a robust policy environment and the framework in this country. Through this slide, I would want to talk about what are those key enablers that can really unlock the economic value of OTC medicine in India, what Susan has explained all through. The first is empowerment. Empowering every Indian to responsibly self-medicate through clear and useful information about the right product for right ailment at the right time. Thus enhance this whole health outcomes and limit harm from misuse of abuse on medicines. And this is what I was also hearing from the previous session, that how do we limit? AMR is one such example. Engagement. OTC regulation will also increase engagement with pharmacists and evolve their role to be well-informed influencers to advocate responsible self-medication practices here in the country. Then the third enabler is encouragement. With this first of its kind, assessing the economic potential of self-medication, the pharma industry in India is really encouraged and has come together to propose the necessary revisions in classification of drugs, labeling, advertising, distribution, pricing, and the entire switch process from RX to OTC drugs. And the last but not the least is we propose that OTC legislation should encompass all the pertinent regulation necessary to govern OTC drug effectively and should be the principal law, which is regulating import, manufacturing, promotion, distribution, and sale of OTC drugs. Now, the need to recognize OTC medicine as a separate category of drug in India is definitely evident and is a need of the hour. And I'm sure all the stakeholders will continue to work to have notified OTC guidelines in the country. With this, I hand it over back to you, Khyati. Khyati, please.
Thank you. Thank you so much, Susan, Josi, and Nitika, Garg, for sharing these insights of the over-the-counter report. I think all of us are going to take some great takeaways from it. Ladies and gentlemen, before we move to our next segment, I'd like to invite back Mr. Milind Thatte to welcome and introduce our next speakers. A very warm welcome to you.
Yeah, thank you, everyone. And there is going to be a wonderful fireside chat between two very, very important personalities. Susan, you have just now met, Managing Director of Havas Health and You, Southeast Asia. With more than 38 years of experience in pharma and consumer health, Susan has also played significant role in building some of the iconic OTC brands. Her active role as a knowledge partner of OPPI task force has steered discussions with regulators to push the OTC agenda in India. With her, we have Judy Stenmark. Judy is Director General at the Global Self-Care Federation, which is an association of manufacturers and distributors of non-prescription medicines. As a Director General, Judy leads the GSCF strategy while managing and developing the organization's operations and its relationship with members and other key global stakeholders, in addition to representing the self-care industry. May I welcome Judy and Susan for a wonderful fireside chat.
Absolutely. While we have... Thank you, Susan. Thank you, Judy, for joining us. May I also take just a moment to thank Mr. Milind Thatte for playing such an active role today in steering the entire summit until now. Thank you so much for being here. Over to you, Susan and Judy. Thank you.
Thank you, Kathy. Thank you, Milind. It's truly my pleasure to share the dais with someone like Judy, whom I really look up to, because, you know, the same passion that I have in OTC and self-care, I have been following Judy. I've been seeing her role in the Global Self-Care Federation, and she has done some stunning work in the last 2 years. Thank you so much, Judy, for joining us in this call. And I thought that with no further ado, I would go to this fireside chat, because I know that we are running slightly late. So I thought, let me kind of get on to the chat. So Judy, given that a similar value of OTC studies have been done in so many other countries, I wanted to hear your perspective on how it has benefited these countries in shaping their self-care agenda. And what would be your advice for us?
Okay, thanks, Susan. First of all, I just want to say a big congrats to OPPI, because we're in the process of bringing our new global value study to life, and I know it is a huge job. So congrats, because it's really fabulous and will help all of us around the world. So I think what's important is there's still a lot of opposition to self-care around the world. You know, we are in the thick of it, and we know that how important it is and how much value it can bring. But there are a lot of skeptics out there. So how do we change that opposition to support? We really need to demonstrate the value of self-care to policymakers and others. So doing these kind of studies is absolutely critical. So I think I would say, it's so important you've done it, because this is the only way we will change policy level around the world. And let's face it, policy change starts at the country level. It doesn't start at the global level.
Yes, of course. I think very pertinent, Judy, because like you said, you know, we've seen in countries where these studies have been quoted over and over again. And we just thought that, you know, it would be very important for us to bring in some confidence in our regulators also. And in that note, I also wanted to ask you that, what do you think are some of the best practices in terms of the whole self-care promotion that India could take some inspiration from? Example of some of the, of course, developed countries like US and UK are far ahead, but there are also other countries like Brazil, Mexico, which face similar challenges like India. So what would your advice be?
Mexico and Brazil are good examples. So in terms of best practice in promotion, it's hard to pull out one from the other. I think you've done this study now, you've got it, and everyone's probably taking a deep breath because great, we've done it, we've published it. But the really important thing now is what you do with it and how you promote it. So I can't say that Mexico did a great job of promoting their study and in the Latin American area, but really it was about having the right people and the right strategy in terms of how you use it. And yes, promotion, PR, that's all important. But then what other pieces do you need to create to really get it on the policymakers' agenda, and also the Healthcare Professional Association agenda? Because I think it's fair to say pharmacists are very on side in terms of self-care. And we think they're like critical in the center of the self-care continuum. But not all doctors are on side in terms of self-care. So I think I can't say to you that Mexico did this great promotional job. It's different for every country, but I think no doubt you've got an outreach plan already for the report. And I think that is critical, what you do with it on a PR level and promotion level, but also on a policy level. What's important for all your other ministers, not just the Minister for Chemicals and Fertilizers. But we really have to, and we're looking at this now, you have to make it easy for them, these policy makers and heads of different important NGOs, etc. So the pieces you create from this, like your executive summary, your slide deck, your one-pager, things like that, that we did for our self-care readiness index that we'll talk about in a second. That's important. We've got to make it easy for all these policymakers so that they can see, oh yes, okay, that's what they're talking about. This is why self-care is important, and go from there.
Absolutely, Judy, and I've been again watching your space on social media, and I think GSC, as Global Self-Care Federation, is doing a fantastic job, and that's where I think, which brings us to that very, very important, report, that work that you've been doing in the last 1 year on the Self-Care Readiness Index, and we also want to do it from India. Just your thoughts on it. What is the background, and how do you see it moving ahead?
Okay, just quickly. So I'm just holding up. I hope you probably can't see with the background. That's the report, the Self-Care Readiness Index, phase 1. And this is a critical component of our collaboration plan with WHO. So what is the Self-Care Readiness Index? It is a policy piece, and it's the first of its kind research that explores critical enablers of self-care across various health systems around the world. And really, it's about supporting different countries and different groups like OPPI to build a foundation for how we can enable self-care. So we had a group of 10 countries last year. We launched it at the end of the year during the World Health Assembly. India is part of phase 2 this year. But just quickly, there are 4 enablers that we used in terms of the basis for our research in each country: stakeholder support and adoption, consumer, patient and empowerment, self-care health policy, does it exist? And it doesn't in many countries. And what's the regulatory environment? And then what do we need to do to change the needle? So I think the index, as well as our global study on the economic and social value of self-care that we are launching at the World Health Assembly in Geneva on May 26th this year, these 2 components will be critical for then country associations to use, but also for us, because just to finish, what we are driving for as a global group is a WHO resolution on self-care. Now, it's a big job. We've started the journey, so to speak, with what we need to do. We have a task force. We're bringing stakeholders together. But what we think is it may take years to get this, and we may never get it. But everything we do in the next 5 years, let's say, every policy piece we create will be critically important to help us get self-care where it needs to be. And everything flows down once, say, a resolution is created. So we need the help of OPPI and people like you to take your value of OTC study. Let's put it with the index, and really let's push it on a local level as well as the global level.
Thank you so much, Judy. I think this was the final thing, because at the end of the day, these studies should not remain in the boxes, but it has to come out. It needs to kind of connect the dots. And of course, the moment we also see it from the readiness of our country, our policymakers see the value of going into the, implementing these policies, empowering our consumers, and really making it into a more responsible self-care ecosystem. So once again, Judy, thanks so much for your valuable time, sharing the dais, your perspectives, and it means a lot to us. And we are with you. We really want to be more and more stronger in our commitment to see that how do we really empower and give our consumers and our marketeers the value of making self-care a very important agenda in our country. Thanks once again.
Thanks, Susan, and congratulations again to OPPI.
Thank you so much.
Thank you so much.
Thatte.
Thank you so much, Susan Josi and Judy Stenmark, for this wonderful conversation and sharing these insights with us. Thank you once.